Dr. Dave's on the phone, and he just did another deposition, and I want him to share the results of what he had. And Dave's one of the clients that increased his business $500,000 in under 1 year. And he'd been in practice 10 or 11 years and never really did much in personal injury, like most chiropractors, because they didn't know documentation and they didn't know educational sales. Let's do this, Dave. Tell me the end result of kind of, the nut of the end result of what happened, and then let's go back into and break it down step by step. Is that okay?
Yep.
Okay, so let me introduce Dr. Dave again. He's started working with personal injury. Again, he's been out there for 10 or 15 years and never really did much in personal injury, had plenty of attorney practices. And prior to doing our personal injury, you met with attorneys and didn't have much success, right?
Correct.
Okay. So then he learns the documentation that's very specific for the soft tissue injury, which tests are more sensitive, which tests are objective, what's the order to put them together, all those things. And then he had to learn how educational sells. So then he starts doing presentations. And how quickly, as soon as you started doing presentations, did you get immediate referrals?
Very quickly.
Do you remember if it was the very first one?
The biggest success I had was I did one of those workshops you talked about where I had like a small luncheon and invited about 3 or 4 attorneys, and from there I probably got, from that one luncheon alone, probably over 100 referrals over the course of time.
Oh yeah, and we calculated Dave was going up over 10 referrals a month. With his case average, he was up to $500,000 under a year. And he has one associate. Now he's looking for a second associate. And so Dave's been kind of a good role model in that he just, everything we did, he just kept doing it. He made plenty of mistakes, but he'd come back to the webinars and clean them up and then go do it again. And so here we go. He's been in court several times now. So go ahead, Dave, and tell what happened with this latest court case.
Today's court case, it was against Progressive, minor impact. Patient went to the ER, had a CT scan. They told her nothing was wrong, take some meds, she should be better in 2 to 3 weeks. Follows up with me 3 weeks later, does the treatment. The insurance company offers $9,000 total, which barely cover her medicals. I show up to court. Explain, I can go, if you want me to go into detail, we can do that, exactly what I said, really short and sweet. And the judge ruled $20,000, which was only $5,000 below the total max they're allowed to do in Virginia General District Court anyway.
So Dave over doubled the case. Now there's a couple really interesting things that you need to know about that. First of all, you may say, well, that was only $20,000. Well, here's the deal. Dr. Dave's in Virginia. And they tell him the situation with how it goes to a judge first, and then from there it goes to a court.
The way it works in Virginia is any case that's under $25,000 goes to a judge. It's called General District Court. The maximum the court can award, no matter what the policy limits are, is $25,000. Anything that's above $25,000 goes to circuit court, which would be by jury, trial by jury.
Okay, and here's a couple of points that I wanted to make. Number one, Dave's testimony more than doubled the case, number one. Number two, the venue that he took is the venue you were supposed to take. Now, you could go for more, but what we teach and what you need to understand and what Dave did right is you have to know what is available with the financial drivers relative to the case. Not every case is $1 million case. And this is what is so important. So walk through the injury. This person had no disc or nerve injury, right, Dave?
Of the 5 injuries we talk about, the only injury confirmed was the spinal ligament injury. She was negative on the 4 other injuries. Okay. No concussion, nerve injury, no disc.
And this is what I want everybody to understand, because they could easily sit here and say, well, $20,000, we get that offer. So they could see that as, some, depending on where you're at, that could be low. No. here's what you need to understand, is we're dealing with a very low case. So we got no disc injury, no nerve injury, no mild concussion. We have a soft tissue. And, Dave, was that AOMSI or was that only altered intersegmental motion?
It was AOMSI, but she had no impairments when she reached MMI. It wasn't interfering with her life or stopping her from doing anything, really.
Okay, so we have the soft tissue injury, but we don't have, we have an impairment rating, right, Dave?
Well, you have it based on film, but based on duties under duress and loss of lifetime enjoyment, not really, because she pretty much fully recovered.
Well, she recovered from those activities, but she didn't recover from the AOMSI. In other words, the AOMSI injury didn't go back to normal, did it?
No.
Okay, so that would be an impairment rating. Now, it would not fit under the restrictions or limitations of activities of daily living or duties under duress. So you did not get those, right?
Yeah, because they weren't existent at MMI.
Okay. So, and you exhausted the plane of motion that was most effective in overpressure, right?
Yes.
Okay. And by the way, these are normal. This happens. Not every case has all 5 financial drivers, but I wanted to also point this out and show you the juxtaposition, the difference this made, this type of case with this little type of documentation versus what you normally would have gotten. So Dave did not include an impairment rating. He did not have loss of enjoyment of lifetime activities, duties under duress. And so for a prognosis, you had no need for future care then, did you?
I said just for flare-ups, from occasional flare-ups that she may have as needed for palliative care.
Okay, so that was like minimal to nothing because the need for future care is dependent on an impairment rating. So essentially what Dave had is out of the 5 major injuries. So he looked for them, but my point is out of 5 of them, he had 1. And with only 1 soft tissue injury, he was still able to, with no impairment rating, no loss of enjoyment of life, duties, activities, no need for future care, he was still able to more than double the injury. And this is the point that I'm trying to make. So the last thing is Dave said that the judge takes, because that's the first thing I asked Dave. I said, well, Dave, what's it going to take for in your county to take it past $25,000? And Dave said, well, you can, but you have to have the financial drivers. And so what was the smart thing Dave did? And that's what we talked about, is he educated his attorney. Dave, did you not tell that attorney what he exactly did have with financial drivers and what he did not?
Oh, absolutely. I explained to him, that to get significant value beyond general district court, there needs to be an impairment rating, and we have to show that it's permanently affected her life.
Exactly. That's why it stayed in the lower court under 25. And the bottom line why it didn't even go to 25 is that's more of a psychological thing. There's just a lot of resistance to push a number to its nth percentile. So when Dave shot it up to 20, that's what's called the 80% rule. That's pretty much what he would have gotten. So anyway, now what would he have gotten if he did not know how to document that and he would have just put cervical sprain strain? So Dave, could you imagine if you would have only had cervical sprain strain, how would that have gone in court?
She may have been lucky to get $2,000 to $4,000 above medicals.
Yeah, I mean that's when you got absolutely nothing and that's the typical chiropractic diagnosis of soft tissue injury: cervical sprain strain for the injury, which is it's very worthless, and then you have no impairment rating, and then you have no positive findings in activities of daily living, loss of enjoyment of life, duties, activities, and then there's no need for future care. And that's the case the chiropractor whacks on a large bill to, and then they bitch and complain to the attorney when the attorney asks for a reduction in the bill because the attorney does not have the documentation to support the medical findings. And what you need to understand as the chiropractors, number one, you need to know how to document everything, but even when you know how, that doesn't mean you're going to have all the financial drivers there. It means you're just going to have a lower case. That's all it means. And that means your bill should be lower. Your bill should not always be a $10,000 bill just because it's $10,000 in PIP. And that's when you really start pissing off the attorneys. You can do that, but you will kill your referrals. That's when you're only playing the game for 1 or 2 shots, and it's over with. So it's also having an understanding of what is being documented and what financial drivers you have relative to the bill. So if you don't have much, you shouldn't have much of a bill. Now, having said that, by the way, and letting the attorney know all the financial drivers is what's most important, not what financial drivers are positive, because that lets them know you know what you're talking about. Now let's go into some really good stuff. So Dave, can you go into some of the key components of your testimony that were important?
Yeah, to me, the most important thing is when your attorney gets to question you first, it's very important to lay out what your specialty is and talk about 80% of what you don't do. So I explained that I'm licensed by the Board of Medicine to focus on soft tissue, musculoskeletal cases only with conservative care. I don't treat disc, nerve, concussions. I have a medical team. If I find any signs or symptoms of those, I would refer them out to the appropriate medical specialist. But I am fully trained as a primary doctor and authorized by the Board of Medicine of Virginia to treat soft tissue spinal ligament injuries, and that's what I did.
Now, let me. Dave just hit on several major issues for the new guys that are learning this. Number one is we do give you a list of questions of how to win the case, how to do a deposition and how to win a case. So Dave used those questions, and then he gets with the attorney, and the first thing that we do is what's called a preemptive strike. And we want to go into all the negatives about chiropractic, of what they're going to try to do. So we handle those and minimize them. But also what Dave said that's very important, and we talk about this over and over, that is a major problem with chiropractors. Chiropractors have been taught through this thing called subluxation that it's okay to say that they can treat everything. And you don't understand, you're killing your credibility. You have to be something, and that's why I told Dave this early on. From a marketing perspective, you can't be everything. You would destroy your relationships with attorneys. You'll have no credibility in court. You can't do that crap. You can't talk about subluxation and you treating cancer and asthma and allergies and everything else. You have zero for credibility, and it's like the number one problem. And so I emphasized the heck out of that. And so Dave stuck to it, and he narrowed his focus. As a matter of fact, Dave took out all of his subluxation charts and didn't even allow his staff to say the word. In other words, he became something to somebody. He became neuromusculoskeletal, back pain, neck pain to a target market. And when he did that is when his credibility skyrocketed. And what is so important to not only do that is to give credibility away, is to tell them what you don't do. And those are vital to helping credibility. So Dave learned to do that and did that. And by the way, Dave, what's happened when you've learned how to narrow your focus and give away credibility for the other things you're not good at, like the disc injury, nerve injury, and your medical team takes care of those? What kind of response did you get from the attorneys and in court?
It's utterly amazing. You get respect for that specific area. And when I made the mistake one time, the first time I didn't go to court because the attorney didn't listen to me, you get badgered for 20 minutes about how you're a chiropractor, you're not a medical doctor, you don't have hospital privileges, you don't prescribe drugs. When you do this preemptive strike that takes less than a minute, the defense attorney literally has nothing to say and agrees that you're an expert. It all goes away when you do this.
And then even if they do, because I'm sure they tested you, even after you did it, how easy is it for you to just come back and reinforce it, that your specialty is in MS, You deal with, back and neck pain, and if there's disc injuries, nerve injuries, and concussions, those go to your medical team because they're the experts in that category. How quickly is it, even if you were challenged, to come back and knock them back down?
I would disagree with what they said, that's not my specialty, and I would refer to my medical team. Exactly.
Okay. And as soon as that happens, what happens? As soon as you've done that, what happens to the credibility with your referring attorney, the plaintiff's attorney, the insurance attorney, and the judge?
They look at me as an expert in this particular area.
Right. Okay. So those are some major things that are important, Dave. And what else would you say? So you go through, and what are some of the other major things you did to put the case together and win it?
I basically just explained I explained real simple terms, like 8th grade language, that I did a history to understand the mechanism of injury, that it was consistent with a shear or compressive force that entered the spine. I didn't want to talk about car damage, nothing about outside my scope. And I said, then I showed the judge with a model. I said how force goes through the 3 ranges of motion, and if it goes beyond the 3rd range of motion, it can cause damage to the ligament. And then I explained my orthopedic tests and measurements and explained how they work, especially range of motion with overpressure, that test was sensitive to a ligament injury. And that is why I clinically ordered the CRMA, because it's the only objective test to quantify the specific location and severity of the injury. Pulled out my AMA guides and said, this is why I ordered this test, was confirmed by a medical radiologist, but it let me know at C5 she had a full-blown ligament tear. And then I explained the 3 phases of healing, the physiological benefits of my treatment, why they were treating that ligament tear, and why I treated. And then I explained the whole thing about re-exams, and when they plateau, that's when they're released. That's all I had to explain, and that was really it.
And Jake said something to me that was really interesting. The attorney tried to focus on one soap note. Tell that story.
The defense attorney really had nothing. She tried to pick on 2 soap note dates where the patient said they were feeling 75% better or was feeling great. And I just came back and explained exactly what you said. I said, that's a micro picture. I said, doctors, when they treat properly, they base on macro trends. I said, spinal ligament injuries tend to have good days and bad days depending on what the patient does, re-exacerbations. And we look at trend lines over a 2 re-exam period where they stabilize. We don't make a clinical decision to release a patient based on 1 micro visit, whether it be a really good report or a really bad report. And the judge understood that completely.
Yeah. And so a couple they've covered many main points right there. And let me come back and point out what he has covered. Number 1, he covered the 4 pillars of how to put a case together. And that is how you have to tell the story. So remember, you have to tell the mechanism of injury that caused that accident in your opinion. Then you have to talk about what are your subjective and objective findings. That includes totally subjective, hybrid, as well as objective. And explaining those. And then going to what therapies you used and why you used them. And now that is based on their findings and the 3 phases of healing. So you should be able to explain that. Then that took you to your SOAP notes and your re-exams. Those are called your micro trends and your gross trends, and that's what determines 3 things. It determines how the patient's responding. It determines whether you need to send them out for a second opinion. It determines whether you need to modify your therapy, or it determines if they're at MMI, they have a permanent injury. And that's the purpose of those re-exams. And then the last one, so that's called the 4 pillars. So Dave explained the 4 pillars. That's what puts the case together. That's what he just said. Number 2, he said the third-party trust factors, and we talk about the importance of these. And some of those were the AMA guides and the third-party objective findings of the CRMA. Those are very vital. That's called third-party trust findings. You have to use those in chiropractic. And then the next part was the 3 phases of healing, how the patient responded relative to their injuries, relative to the phases of healing. And Dave covered that also. And then then the last part is relative to the SOAP notes and re-exams are the bare minimum of MMI is when there are 2 re-exams. Remember, by definition, it's when there's 2 re-exams, not SOAP notes, 2 re-exams at the end of the 3 phases of healing with no likelihood of subjective or objective changes. That is the pure definition of MMI. But I said I would feel okay if I called it MMI if it was in the 3rd phase of healing and I was at 2 re-exams with no subjective or objective improvement. So Dave explained that was the determination of care, not an individual SOAP note. And so Dave covered a lot of major points. So Dave, can you see how much you're just flying through now because you're kind of in a state of unconscious confidence and now you just take all this stuff for granted and then I come back and break it down. Can you see how much you've covered, Dave?
Yeah, and it didn't even seem like that. To me, it was like I made a few points, and you're right, but that's all the stuff that I learned over the 2 years with you learning this stuff.
Right, and didn't take Dave 2 years to learn this, did it, Dave?
No, but it did seem overwhelming at first, and now it seems like it's 8th grade elementary, once you've done it enough.
Yeah, and this is Dave's, I think, 2nd or 3rd testimony, is that right?
This is my 3rd court case in the last 2 months.
And Dave has not lost, have you, Dave?
Nope.
Dave is not, and let me tell you, one of the first cases Dave had was unbelievably difficult. I was surprised he won it. But he won it in the same format. It's the same format that wins. So, by the way, how did you get that attorney to refer you that patient?
That was that luncheon I did where the adjuster was sending me the patients that had no primary doctor health insurance. They were referring them to me because they knew I would see them and wait to get paid until the end.
Okay, so is he one of the guys you gave an educational sales presentation to?
Yeah, yeah.
Okay, so did he have any plans on sending you a PI patient prior to you doing an educational sales presentation?
Absolutely zero.
Would you have any of your attorneys sending you any PI cases if you had not done the PI attorney educational sales?
No, because their perception is chiropractic has no value in court or with personal injury.
Now Dave's going into overdrive now, and I call Dave a black belt, and he's going into overdrive, meaning now he can go after the AA attorneys because he not only knows the material, but he knows how to control them. Now, Dave, I want to go into one last topic here, and that's called the takeaway. And one of the things that I teach is not only to give credibility, one of the topics that I talked about, to gain credibility, but one of the concepts is called a takeaway, and it's a very important concept. And that's when attorneys kind of throw an obstacle at you, and so Dave, tell me the takeaway that you used in this court case.
The takeaway that I used?
Yeah, the takeaway meaning there were no other options.
You mean in the educational sales part or this case? I guess I don't understand your question.
In this, remember, and I'm not asking it as clean as I could, but you remember you were telling me you were saying you were doing this, this, and this, and this, and then you were very clear saying, I don't do this, this, and this. Now, that's called a takeaway. And so can you explain that and how that just smacked it over the fence?
That is 80% of the game is explaining, and to me, it's establishing credibility. You have to explain what you don't do, and you give it away, and then it makes you credible in what you do. And so 80% of what I focused on even when I do educational sales with the attorney or I'm talking to the judge, I say this injury, this injury, this injury, this injury. This is for a neurologist. This is for an orthopedist. But this soft tissue spinal ligament injury is not seen on CT or MRI. We have to order the specialized test. The AMA guide says so, and that's what this is the only thing. This is what I do. If that's what you mean. I gave everything else away.
Yeah, and that's called a takeaway. In other words, we pay a lot of attention to things we don't do and give it away, and that's why it's called medical team and third party and not trying to be everything. So when you actually deliver meaning you have the documentation, the five categories of financial drivers. Number 2 is the 4 pillars of how to put the case together. Number 3 is how to handle pre-existing and low-impact injuries. That's when you are the expert and you don't lose. Now, one last thing. Go ahead.
There was just one last thing. You talk about those 8 or 9 things you bring up. The only factor that came up, because I educated my attorney, is he asked me about people being braced or hit by surprise. And I was able to explain that the muscles protect the ligaments. But in this case, the occupant said she was hit by surprise, which makes the ligament more susceptible to injury, which would make sense why she had a full-blown tear at C5 on the CRMA report, why that ligament was more susceptible to damage with a low-impact case, because she was not braced. She was hit by surprise. And the defense didn't even go after that at all. Everybody just accepted it.
Right, and that's one of the 9 characteristics and factors that we know how to show that magnifies an injury. And that's how you win these cases. Now, the good thing with Dave now has established himself. He's won 1, 2, 3. This is his 3rd case. Dave, now tell what you can do with this case with marketing purposes now, Dave.
When I go meet with attorneys in this area, they want to know the judge, who the insurance company was, who the other attorney was, and now I have a resume. I can give them a specific case, who the judge was, who the insurance company was, and I tell them the initial offer and what we were able to do, and that grabs their effing attention. You're talking their language now.
Now, the one thing I want to emphasize, that's what happens when you actually win a case. And I told you that's what happened with me when I went to case and when I went to court, when the case went from 0 to policy limits of $110,000, I didn't need to market again in my life. Now, the last thing I want to say about that, Dave did not have that. So all of you guys that don't have any court experience, you cannot use that as an excuse. You can't say, well, I can't get referrals because I don't have court experience. No. Dave, how many referrals did you get through educational sales before you went to court and won your first case?
Most of all my referrals are before I ever went to court. They were from educational sales.
Over 100?
Probably close to 200.
Did you? Okay, I want to emphasize that to people that try to take an easy way out, Dave. So many people, I've heard chiropractors say, well, I've never been to court, so I can't, they kind of use it as a crutch and an excuse on why they can't get referrals. And so I wanted to just make sure that it is not about winning a case in court, and then that's what gets you referrals. That is not how it works. The educational sales is what gets the referrals. David already made over $500,000 his first year before he went to court and won his first case through educational sales. And I just wanted to be real clear on that point. Anything else you'd like to add to that?
I was just saying that gives me another thing to put it into hyperdrive where I could go after the A-level attorneys. I do have to run out back to the office. So if there's anything else, I got like 2 minutes left.
Yeah, the real last thing is, how easy is it for you now to generate personal injury referrals and income?
It's once you own it, you'll realize I just feel like like you said, there's energy and effort you have to put into it, but to think about anything else you would have to do in the world to create $1 million revenue into any kind of business, it's the most easy, simple thing to do. And if you know how to educate people and perform, you have zero competition. So I can't think of any other business idea or thing that you would have to put your time or energy or money into that would create $1 million revenue easier. I absolutely agree with you.